Hello friends, welcome to a new topic today. In this chapter we are going to learn about the simple renal cyst. So in this simple renal cyst, first we will learn about the way that the important things. So in the simple renal cyst it can be acquired more commonly when compared to congenital. It is more commonly seen in age group more than 50 years. And this simple renal cyst can be divided into two types. One, we have solitary renal cyst, that is there is only one cyst in the kidney. Second, we can have multiple renal cysts. These solitary renal cysts, if you see, they are always acquired. Always remember, they are always acquired. And the most common cause of solitary renal cyst is trauma. Because of the trauma, because of the cyst, what happens is, whenever there is trauma, because of the blood, hematoma formation or blood bleeding out, there will be blockade of tubules and finally leading to cyst formation. So this cyst, you see clinical features has, you see unilateral renal mass is seen, and this renal mass is smooth and tender. If it is infected, there will be tenderness. Then how are you going to treat this? The main treatment of this condition is, you can do Kirwan's operation. What is Kirwan's operation? In this Kirwan's operation, the kidney is exposed and the cyst is aspirated. The portion of the cyst is removed. You will first expose the kidney, aspirate the cyst, and then remove the portion of the cyst. So that is Kirwan's operation. So if you see, if this is the kidney and this is the cyst, you will first expose the kidney, you will first aspirate the cyst and then remove the cyst wall. Okay, that is Kirwan's operation. Then what do you see grossly? If you see that the cyst is grossly, this cyst is located in the cortex as the most common site. Okay, you see yellowish white translucent wall with straw colored fluid. Yellowish white translucent wall is seen in the cyst with translucent with straw colored fluid. Okay, if there is hemorrhage, then it becomes rust colored also. Microscopically, you see that the cysts are made up of flattened epithelium. Okay, and the wall of the cyst has collagenized fibrous tissue with hemosiderin and calcium salts. I will show you the pictures of these also, just a minute. Okay, then if you see the acquired cyst, then important thing is acquired cyst. The causes of acquired cyst can be anything, starting from the first patient with end stage renal disease or hydatid cyst, TB of the kidney, cyst degeneration of carcinoma of kidney, traumatic intrarenal hematoma, or drug induced cystic disease. All these can result in acquired renal cysts. Then we also have something called as pararenal cyst. What is pararenal cyst? If this is the kidney, if this cyst is surrounded by, if the kidney is surrounded by the cyst, then we call it as pararenal cyst. In the surrounding tissue, if the surrounding tissue of the kidney, you will find this cyst, then you call it as pararenal cyst. What are the causes of this pararenal cyst? In the pararenal cyst, you see it can occur due to pyelocalcial cyst or hilar lymphangiectatic cyst, retroperitoneal cyst, and perinephric pseudocyst from trauma. All these can also result in pararenal cyst. This is not that important. Let me show you the pictures. So if you see, this is the cyst which you see grossly. Okay, grossly you see large simple cyst which is seen on the right upper pole. Okay, in this is the CT scan where you can see this renal cyst, right? This is the renal cyst which you are seeing, this one. Okay, this is the you will see large renal cyst. Okay, next. Sorry, this is not the renal cyst. I'm really sorry. In this picture, this is the renal cyst. I'm really sorry. Okay, this is the renal cyst which you see. This is the kidney. here which is normal, but here you can see the renal cyst. Okay, then this is acquired cystic kidney which you see. Okay, here also you see many cysts which are seen, so this is acquired cystic kidney. Then you see this is the cyst, this is also a renal cyst. Okay, this is the kidney, this is the simple renal cyst which you see. If you see in this picture, this is the renal cyst and it is lined by simple cuboidal or flattened epithelial cells. Okay, so this is the simple renal cyst. Thank you guys for watching my lecture. Thank you.